Happy Friday, everybody, and welcome to the internet's favorite informative entertainment show about plastic surgery, health, and beauty. This is Nip Talk. We got a lot to talk about today. First off, the very first eye and face transplant patient. We're going to tell you about that. Then there's been an IV therapy death at a med spa. What? That's crazy. And then finally, another celebrity plastic surgery death. So much to unpack, and it's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. Leave us a comment. We want to hear from you. I'm the host, plastic surgeon Dr. Bruce Hermann. With me, as always, is the amazing and very well dressed today, Sarah.
Oh, thank you.
I like your outfit. You look
My
great.
leather
The
jacket.
boots, everything. You're spot on. In the box is Travis. I didn't see what you're wearing today, but you're always a snappy dresser, so I'm sure you look good too.
I appreciate it.
I didn't want to leave you out.
Genuinely
Everybody having a good
appreciate
week?
Yeah.
it's been a
Good.
week.
Anything exciting happen?
I'm going to go camping this weekend.
Camping.
Again.
All you do is camp. Where are you going this time?
To Longhorn Cavern State Park.
That's down in Central Texas?
Yes. The hills. All the hills.
Fredericksburg?
Yeah.
The best.
Yeah.
I love that area. It's so much fun.
It'll be a good time.
We ride our motorcycles down there
Yeah.
at least once a year.
Yeah.
It's amazing.
I'm going to a Cowboys game.
I went there. That was the area I went like 2 weeks ago. And then
Yeah.
I saw that state park and I was like,
Nice.
that.
Excellent.
Yeah.
Well, I'm super jealous. That's going to be so much fun. Happy
You
for
can
you.
like go, we're going on like a cave tour. And you like, it's going to be
cave
like
tour?
serious where you like are squeezing through
Oh my
stuff.
gosh.
Going down.
Wow, be careful. I mean, is this like a guided thing, or you just?
Yes, it's a
Oh,
guided thing. And it says
okay.
8 years or older because trust me, I was like, this seems creepy.
Yeah, you always see those stories of people that like get lost in the caves.
Oh,
and
yeah.
I was like,
No,
nope,
that's-
I'm out.
It
I'm
said
not
8
like a
years
cave.
or older, so I'm thinking I'll be safe.
There's people that squeeze through these cracks or like they're
Yes.
underwater. Like, I mean, it just gives me, I don't know.
Why would you do that? Yeah.
I don't know. I mean, I think, Travis, you're a caver, right?
No. No, I'm not. Absolutely not. I wish.
Can
And
you hear
Sarah,
Travis?
if you see
no,
it,
I can't hear
Oh,
you.
Travis, we lost you. That's all right. He's there telling us how much he loves caves,
all
right?
right, how about now?
There
Yeah.
you go.
There we go. There we
Were you
go.
telling us how much you love caves?
I actually was not. Surprisingly. I was saying, Sarah, if you see a bat, like, what will you do?
I'll probably cuss.
I don't like bats, man. I feel like bats carry rabies and they might want to drink my blood. Like,
Oh,
I'm
gosh.
anti-bat. Like, Batman, nope.
Really?
No, I don't like bats.
Oh, gosh.
They scare me.
I feel like that's just in the movies, though. Like, it'd probably be all right.
They probably
like
are pretty chill, you
Yeah,
know.
yeah,
Like
There's
probably
definitely bats in there.
they get
though.
they get a bad rap, the bats. But
Absolutely. I'm supposed to be going to a Cowboys game on Sunday.
are you really?
Yeah.
Nice.
Dude, what happened? They lost last weekend.
Yeah, I know it. But they play the Giants this week, so we should win. Hopefully.
That's great, man. Do you go to the Cowboys games a lot?
I do not. Actually, it's so funny. Like this week, so since I work for a radio station, they actually have a suite that they were like.
Dude,
offering.
you're gonna be in a suite?
No.
Oh.
I'm not.
I was like, what time do I show up?
I was going to, but the suite is like higher than the actual seats that I got invited to the game to.
Okay.
So I'm
Yep.
going to the seats instead of the suite.
Yeah. I can feel that.
Absolutely.
I've done the suites at the Stars game before. That's actually really fun.
Man, they have some nice ones.
They are pretty slick, man.
Yeah.
They are cool. Right
I've
on.
never been to a box seat.
Oh, you haven't? Next time I get a box, I mean, not that I get them all the time, but I randomly get invited, I'll hit you
Yeah.
up.
Absolutely.
Yeah,
Invite
both you
me.
guys. We'll all go. We'll do a show there.
That is dope. I'll take it.
All right. Well, we got a lot to talk about today, so let's jump into some cool topics. The first topic that we're gonna do, to me, is like just really, really cool, really interesting. So, have you guys ever heard of the face transplants that have happened from time to time?
I saw the
You know what we're gonna
the
talk
eye,
about?
the eye transplant.
Okay, you saw it. Oh, very
Yeah.
cool. So today we're going to talk about the first combined eye and face transplant. And I have to tell you that, I mean, I do some pretty cool surgeries, and I consider myself a very, skilled and technical surgeon. But this stuff is just kind of like next level. I mean, face transplant, I mean, that's one thing. I mean, if somebody put a gun to my head, I could probably do a face transplant. I mean, it's just attaching muscles, nerves, blood vessels. I mean, I have the skill to do that.
Yeah.
Yeah, I know. I mean, that's like, it does take, I mean, I did tons of years of training after med school. I don't.
Light flicks.
Yeah.
Well, no, I mean, you know, you wouldn't want me doing your face transplant, but could I do it? Yeah, I could. I mean, I do still sew blood vessels and nerves together, like in the hands. And so, you know, there's not a whole lot of difference between a blood vessel in the face and one in the hand or a nerve. I mean, it's a lot more involved. Sure. Okay, anyway, fine. I'm not doing face transplant, but I'm just saying that potentially I could do one. But to add like the eye socket, because this guy apparently had his eye socket and the eyeball itself transplanted. So a little bit of back history. So the guy's name's Aaron James, and in 2021 he was working around some super high voltage power lines, and it came into contact, and those lines will just like incinerate you.
Yeah.
It took off his left arm, and then most of his face, nose, lips, and his left eye. And so he had a pretty devastating injury. And in a minute, I got some pictures. So in the past, like when something like this happens, you know, what we did is we just would close the wound as best we could. I mean, you know, the thought of doing a face transplant was not really kind of in the sphere, you know, 20 years ago, although it was shortly after that became a thing. And so I actually have a picture from a long, long time ago. It's a patient we did a case study on where they had a similar injury. Yeah, okay, so here. So this, I mean, I didn't want to bring the picture of like this cavernous like hole that this guy had, but this guy had this just massive face wound, and you have to cover it, so we used like a muscle with a skin paddle and then skin grafted the rest, and it's definitely not anything, you know, to write home about from an aesthetic standpoint. Of course, this was 20 years ago, and you know, it solved the problem of him having a cavernous hole in his skull, and well, not really skull, but like his face and bones. Yeah. And so, you know, it solved the solution, but like aesthetically, it's terrible. I mean, you know, not anything that anyone would be happy with.
Yeah.
So then, in the mid 2000s, actually 2005, the first face transplant was performed at the Cleveland Clinic, and I remember when that happened. I was like, "Oh wow, that's like serious, you know, serious surgery."
Big deal. Yeah.
And I actually brought a picture of that girl. She had gotten attacked by a dog. So on the left was her before her injury, and then the middle picture is her like right after her surgery, not like the day after, but maybe a month or two after the surgery. And then the picture on the right is her years after. And yeah, I mean, she does look, you know, different, but she looks very, you know, normal. I mean, with little minor scarring around the lip, but for all intents and purposes, she, you know, looks like a normal human being. And, you know, that was like a really big thing when that first happened.
Yeah.
And overall, face transplants are still pretty rare. I looked it up, and it looks like in the last 20 years, there's been 19 done. Mm-hmm. And so the question pops up, it's like, okay, well, why isn't this, you know, more common? Well, I mean, first off, you don't have a ton of patients who have such devastating facial injuries that they would need one. Right. You know, there's just not a ton of patients out there. And then there is a lot of like selection criteria. Because when you transplant a face, it's like transplanting an organ. Like you have to match up things like blood type, the human leukocyte antigens. Okay. And so, you know, like when people are on transplant waiting lists, it's the same thing for a face. I mean, you have to find a donor that matches up. Obviously, you'd have to match up the sex, right? Because, you know, you wouldn't want to put a male face on a woman, right? So there's a lot of criteria that go along. So anyway, this guy, Aaron James, had a pretty devastating facial injury, and he got hooked up with Dr. Eduardo Rodriguez, who I actually have a picture of him in a minute we'll show, and they attempted to do the first face with eye transplant. And the surgeon even said, there's a chance that this eye is just not going to take, that it's just, you know, it's just going to wither away. But the thought process was, if that happens, well, he still has the face part, right? You know, they can put a fake eye in. There's glass eyes. I mean, that's a common thing. But they wanted to try to get this eye to be functional. So they attached the muscles, they attached the nerve, even the optic nerve, which is, you know, unbelievable that they reattached. Yeah,
I was about to ask. I was like, it works, and it's
so
not,
yeah,
like
we're going to get to that.
Okay, out of it.
So it was a 21-hour surgery. And I'm sure it was a team. I think Dr. Rodriguez, I mean, I know he's the head of the team. but 21 hours, probably multiple surgeons. And so, Travis, let's throw up that first pic there. So this is that gentleman, Aaron James. And so that was him on the left before his injury. The middle is like right before his transplant after they kind of temporized his wound. So they've actually covered some of this with skin grafts, it looks like. But you see he's missing his eye. The nose is gone, lips, the face is just scar tissue.
That is serious.
Yeah, and then on the right is him, I guess just says, 4 or 5 months after his transplant. I mean, there's a little bit of issue with the eyelid, but yeah, and they transplanted the eyelid too. I mean, that's just utterly amazing. And then, like, there's another picture of him, Travis, pop on. Oh, that's the one from the front. Yeah, but I mean, he looks pretty normal there. I mean, I think that's a little bit further along in the healing process, and they're showing that the globe of the eye looks, viable and actually looks pretty normal. Mm-hmm. So to get to your point, Sarah, about functionality, because that's a great question, right? It's like, okay, when you do these transplants, how functional are they? Well, that's where the limitation is, As far as the eye goes, he doesn't see out of it, And I'm not surprised by that. The rate-limiting step to doing any type of transplant are the nerves. Blood vessels, you can tie them together, the blood flows fine. Muscles, you can attach them, the muscles will work fine.
Yeah.
Skin, nerves are a different story. Like when nerves get cut, it does a lot of damage. And even if you cut like your own nerve in, like say, and I do nerve repairs from time to time, you can get complete control back, but that's like your own nerve to your own nerve. I mean, it's a little bit different when it's a transplant cadaver.
That makes sense.
And so, he doesn't see out of the eye, but at least the articles were saying that he does have sensation around the eyelid. So, some of the sensation is returning.
Yeah, I saw them they keep having to lift.
And that's because the muscles aren't functioning correctly.
Yeah.
So like his eyelid's drooping because to keep your eyes open, you have muscles that are pulling the eyelid up.
Right.
And so those muscles aren't functioning for him, and so there are some limitations to this. It's not like they transplanted this face and eye and he's like seeing out of the eye and his face is completely normal. But I mean, you have to start somewhere when you're doing these advanced technology surgeries. I mean, just to get it to survive and look normal, I mean, that's the first step.
Yeah.
And, as the technology for nerve regeneration improves, then maybe the next step is the muscles work better. And then eventually maybe you can actually transplant the eyeball to be functional.
Right.
And ultimately that's where we hope this would go. But I want to throw that guy's picture up there. I've never met this guy. I didn't actually heard his name before. Is Dr. Eduardo Rodriguez. He's chief of plastic surgery for NYU.
Nice.
But yeah, I mean, this guy has done, of the 19 face transplants, I think he's done like half of them. So
okay, so he's pretty
This guy is like
seasoned.
he's probably the world leader in face transplants.
Okay.
So yeah, I mean, hats off to this guy because, like I said,
wonder how much that surgery cost and if insurance helped that guy at all.
Yeah, for sure. I mean, that would be considered reconstruction, and so it would
Okay.
fall under insurance. I mean, when they do these things at like university centers, I mean, it's a little bit different than if I need to have my appendix out.
Yeah.
And I'm begging my insurance for that or whatever. That's a good question. I mean, that's a great question as to how much a surgery like this would cost. I mean, OR time is expensive. I mean, you're talking, $1,000 an hour for that, plus all the equipment, all the fees for all the staff. I mean,
And you said it was 21
hours. Yeah, I mean, a surgery like that would probably, like real cost would probably be $100,000. Now, what insurance would get billed? I mean, who knows? I mean, what things cost and what insurances get billed and then what insurance pays, like numbers that are all just all over the map.
Right.
There's a friend of mine who was keeping a close eye on that story, and
Oh, yeah.
no pun intended. But because they are missing their eye.
Are they?
Yeah, there was a accident that they had when they were a child.
Wow.
And I think somebody was swinging like a stick for a piñata and it hit them in the eye. And their eye is missing now. So
Really?
they were very glued into that.
Yeah.
Just because they wanted to see if the eye was actually functioning.
Well, I mean, the cool thing about it is at this point you could probably say that instead of a glass eye, which does have problems, you could transplant a living eye, and it seems now that it would take. The question is the function.
Right.
And I think honestly, before you can transplant an eye and it's functional, I mean, you're probably looking at decades
Wow.
at best. I mean, because I mean, in the 20 years that I've been doing surgery and doing things like nerve repair, I mean, there's been a little bit of advancements, but not like tons, you know. And nerves are always the kind of catch when you're repairing things.
I wonder, because like nerves, like what if like it like down the line he just like wakes up one day and he can see out of it?
That would be amazing, and I hope that happens. But you know, the problem with nerves is, you know, when you imagine a nerve, think of like a really big cable that might be running through this building, and you cut that cable open, and there's 100,000 different wires. Okay.
Yeah.
Now, if you cut that cable, if it's big enough, yes, you could resplice each of those individual wires, but nerves are tiny. So when we repair nerves, we typically, I mean, especially the small nerves that I repair, you repair you try to line it up as best you can, but it's not like you're reattaching the individual nerve fibers. It's just not technically possible. So you're putting it back together, and then the nerve tries to grow through. It tries to send the signal from the side that's closer to the brain into the side where it got cut, and push through to re-innervate. And it does happen. I mean, when I do nerve repairs like in the wrist and the hand, I mean, most people get a good amount of function back. I mean, it's not always 100%.
Like the surgery I had on my elbow when I was a kid, I had nerve damage right here. I couldn't feel like anything on my forearm for like a while, and then randomly it came back.
Yeah, and sensory nerves and motor nerves are different. Like
That's
usually
weird.
sensory nerves are easy. So sensory, obviously the ones that let you feel, motor, the ones that let you move. You know, sensory nerves are a little bit easier to come back you know, than the motor.
Interesting.
Yeah. So, but yeah, I thought that story was fascinating. I mean, yeah, being a plastic surgeon, you know, hearing about face transplants to me is super cool. I personally don't have any interest in doing them. But then when they transplanted an eye socket, I was like, holy, that's like legit.
Have you ever seen Get Smart?
Yes.
And
like the new one with what's his face?
Yeah. Well,
Michael Scott.
Yeah, Michael Scott was in it, but the girl, what's her name?
Oh, Anne Hathaway.
Anne Hathaway.
I love her.
She's in it, and her character, she has a face transplant because she's a spy.
Oh, right. Yeah, I remember that.
And it was like a joke because he asked, like, what did she look like before? And he was expecting her to look like plain. But it was like another supermodel looking person.
Right.
So he was like, oh, yeah.
Yeah.
Good thing you got your face transplanted.
Hey, who knows in the future, like 100 years from now, maybe, you know, people will pay cosmetically to get a better face. You ever think about that?
Maybe
could
so.
be happen. I mean, that could be a reality. I mean, that's like some serious ethical issues. But
yeah, but then it's like, why wouldn't you just get plastic surgery to like make it better?
I don't know. Maybe you just want something.
I guess if you really wanted to look exactly like somebody else.
All right. Well, cool story. Hey, let me know what you think about the eye and face transplant. We'd love to hear your thoughts. And don't forget to hit that like and subscribe button. It does help us so much. So, all right, moving on. I got a couple of sad stories to go on to. Well, I mean, they're sad. I mean, these are good ones to talk about because, you know, the face transplant was a cool story, but this is something where people could learn something that might, you know, protect them. So that's why we talk about it. It's not obviously to sensationalize people that die. But so this is a story about a death at a med spa from IV therapy, which is pretty wild because as I've told you guys, I'm opening a med spa myself.
Like IV therapy for like rehydration.
Right. Yeah. Okay. Yes. So that's what I think of when I think of IV therapy is like hydration, vitamins, you know, minerals, antioxidants, that kind of thing. And so when I heard about this story, and it kind of broke a few weeks ago, and since we had recorded some shows, we actually haven't had a show since this thing kind of broke. So this event actually happened in July of this year. And the story kind of broke, I guess, because the autopsy came out, so it kind of hit the news again. So this happened just close to here. It was in Wortham, Texas, which is about 60, 70 miles from here. So
never heard of her.
So it's kind of by Mahia.
Okay.
Yeah. So this was at the Luxe, Luxe Med Spa in Wortham. And this lady who actually was a radio personality, have you heard of her, Jennifer Cleveland, Travis, being in the radio?
Jennifer Cleveland, I have not.
She was one of those stations down, like just south of Dallas, I think.
Okay.
Yeah, I can't remember. I read it, now I forgot. I should have written it down. But so she went to this med spa to get IV therapy, and had a sudden cardiac arrest, and that's pretty crazy because you know normally these therapies are extremely safe. I mean, putting IV fluids into your body could be harmful if you put like the wrong type of fluid, like say you used like just sterile water and it dropped your electrolytes or something, and that could potentially be harmful. But you'd have to give a lot of fluid for that to happen. And, I mean, in general, giving IV fluids is pretty routine. I mean, there's a ton of IV therapy places around the Metroplex and in every town. And IV therapy has gotten really big. I mean, when it first kind of came out, I was like, oh, yeah, I can understand that. Because, like, when people get hangovers, if you have, like, a hangover from drinking or just kind of feel down, you go get IV fluid bag, you feel great. Make it feel like $1 million. And so I'm not surprised that this has gotten popular. And they expect it in the next few years, by 2026, to be $11 billion annual.
Yeah, I know.
Like, that's huge revenue.
I know one person that has that as a company, and then I know two. And
then
I know another one that works for a company that does that. Yeah.
We're going to start doing it when we open the med spa here in a couple months. I mean, because people want it, and in general, it's safe. And so, when I heard about this story, I was like, oh, geez, what happened? Why did this girl die? Well, this story was a little bit different because in her IV bag, they had what's called TPN, which you guys probably haven't heard of that, right?
No.
Okay.
Have not.
So total parenteral nutrition. So how I know about this is when I was in general surgery, we'd have people in the ICU from trauma or being really sick or whatever. If they couldn't eat and you couldn't use the bowel, because the first thing you do if somebody can't eat is you give them like a feeding tube. Whether it be one through the nose as temporary or permanent one through the skin, and then you actually give them, like, for all intents and purposes, like Boost or some nutritious liquids to give them nutrition.
Yeah.
But sometimes patients can't use their intestines because of various maybe intra-abdominal surgeries or whatever, and so you give them what's called TPN, which has lipids, proteins, carbohydrates, and also electrolytes.
Okay.
And the electrolytes is what probably got her because have you guys heard of potassium? I mean, I know you guys have heard of potassium, but have you heard how potassium could potentially be harmful? Is that common knowledge? I forget because I've been in medicine too long. Not knowledge. Okay.
I've heard, but I forgot.
Right. Okay. Well, when they do lethal injections, what they use to actually kill the person is potassium. Because if you give enough potassium to somebody through their IV, it'll stop your heart.
Like for prisoners?
Yeah, like for death row people.
Oh, okay. I was like, that just sounds so weird.
Wait, what did I say? Did I say something confusing?
Whenever I think of potassium...
Am I confused or are you confused?
No, I'm just confused. Whenever I think of potassium, I think of bananas. So
Right.
Yeah, I just think of
They're not just like giving them 100 bananas. No.
Yeah, I know. But that's
like
what you think of in your head.
No.
It's like, all right, you're going to die by bananas.
When they do lethal or put people to death in most states in the United States, they first give them a sedative to kind of make them fall asleep, and then they give them potassium chloride, which if you give someone enough potassium chloride through an IV, it kills you. It stops your heart. It depolarizes the heart, so the heart stops beating, and you die. And so I would guess that, well, everyone kind of guesses. I mean, it's not just me. Everyone is kind of assuming that there was a significant amount of potassium in this TPN, which is really, really odd that they would give TPN. Most of the time you give TPN, you give it over, 24 hours or something. They probably had a 24-hour bag of TPN that they slammed into her, and so suddenly the potassium in there just overloaded her heart, and she died. I mean, that's...
Sheesh.
The autopsy was inconclusive, which would be the case with that. I mean, it wouldn't necessarily... It doesn't, like, show damage. I mean, the heart depolarizes, stops.
Can you, like, check people's blood level of potassium or something?
Yeah, but it may have normalized. I don't know. I mean, everyone is thinking that it was the potassium in the TPN, and it makes sense because it's like, well, what else would it be?
Yeah.
So this is kind of a bad deal. I mean, obviously, because the lady died, but I mean, there was a lot of, I guess, issues with this. It's not like, sometimes in medicine people die through things that are, I guess, not preventable.
Okay.
But this seems like it was preventable. I mean,
I wonder why that TPN is accessible to med spas.
So that's a brilliant question because it requires a prescription.
Yeah.
And so, the story goes a little bit deeper. Every med spa has a medical director. Okay. And so there was a medical director for this med spa, Dr. Michael Gallagher, who's actually an anesthesiologist, like just down the road from here. And so it came out that, he was the director, and he kind of got put to the torch. The Texas Medical Board actually suspended his license pending an investigation into this.
Yeah.
Which, I mean, I think is reasonable to do because, you shouldn't really be giving people TPN. And also, when you go from like giving just IV fluids to TPN, you have to have certain licensing to give that, to be the person doing it. And the girl who's the med spa owner who administered the treatment doesn't have that.
Right.
So there was a lot of like problems here where.
And then like I guess the patient that died, like did she request that type of supplement?
It's unsure. When I saw that she got TPN, I actually started doing a search because I was like, are there people really out there giving TPN in med spas? Like that sounds crazy.
Because you said that's used for people who literally cannot eat for themselves.
Right. Yeah. Exactly.
Like it's because they are malnourished, and
right.
like so a healthy woman goes in there and
it makes no sense. You almost wonder if it was accidentally given. I mean, I don't know. I mean, I hopefully we'll find out more information because I'm sure this will all come out eventually. You know what exactly happened here. But yeah, it's pretty crazy stuff. And I went and I looked. So I did a search of a bunch of IV therapies around here because I was like, are they really doing this TPN thing? That just sounds insane. And no, they're not. I couldn't find, and I didn't do a exhaustive search, but I hit like several of the IV therapy places around where my practice is and in Dallas, and I didn't see anything about TPN.
What if they find it's murder?
That could be it. I mean, I don't know why they would kill this poor lady.
I don't know either.
I mean.
But usually you don't know until you know.
I don't know.
With murder.
I mean, I can't rule anything out. I don't know. I just
say that because I was listening to one of those crime podcasts.
Oh, really? It makes me nervous that my wife watches all of these, like, I killed my spouse shows. I'm like, if I go missing, guys, you need to, like, ask Cindy.
Every time after I listen to a podcast, I'm like, it's murder.
It was murder. It was murder. So, but no, I think this is just unfortunately, a preventable tragic death.
Sounds like it. Sounds like a horrible mistake.
I think some bad things happened here, and like I said, I don't know for sure, but at least from the reporting in the news, that there were some things that shouldn't have happened. So
I wonder if there's ever been any like other red flags at that particular.
That's a great question. I didn't notice that. I didn't see that when I was looking through it.
Well, now it has a severe
and I guess the thing to learn,
flag.
you know, whenever we talk about these things, obviously we want a potential audience to learn something from it, right? Well, I mean, when you're getting things through an IV, whether they be, you know, fluids or drugs or whatever, your margin of error is a lot lower, you know, because it's like a main line, right? And so it's like you have to be aware of what you're getting. And, you know, because of this, I think people should at least be alert if they are going to do IV therapy. What is in this? Is there anything that's potentially harmful if given through the IV? Because if you ask that question about TPN, if you said to me, hey, is there anything in TPN that can harm you if you get too much? Like, yeah, the potassium can kill you. And so I think that's something that potential patients should just be aware of. And also, too, is the person licensed to do this?
Yeah.
You know, med spas are a little bit of the Wild West. I mean, there's some stuff that happens in certain med spas that's kind of, you know, questionable. Fortunately, most of them don't necessarily result in things like death.
Yeah.
You know, but in this case, it did. So it's an interesting story. Have any of you guys ever got IV therapy?
I have.
Have you?
I think.
Yeah. I meant not like in the hospital when you're having surgery or something.
No.
Like as an outpatient? No.
I think I have.
Have you?
Not myself personally, but I've produced a show here, right where Sarah is sitting actually, and there was a guy who did IV therapy while he was doing the show.
Oh yeah.
Yeah.
You could totally do that.
They hooked it up and did it while they was doing the show.
It was so funny. We went on a little weekend vacation with some friends of ours who were doctors, and it was to like a music festival, my wife and I. And when we got there, they had brought like bags of IV fluids, like in case, you know, they drank too much so they could give themselves IVs. I was like, man, that's hardcore. I've never thought to do that, you know, personally. I was like, you guys are all in.
That's wild.
So, all right, moving on. Cool story. Let us know what you think about IV therapy. Do you like it? Do you not? Have you had it? Let us know in a comment. We'd love to hear from you. So, okay, finally, another sad story.
Cool.
Yeah, I know, right? Well, I mean, these things are important because when things like this happen, it's always interesting to talk about them because ultimately, educated people could potentially save themselves or someone else. So
agreed.
That's why we talk about them. Have you guys ever heard of this Brazilian celebrity, Luana Andrade?
No.
I have not.
I hadn't heard of her either. I mean, you may have because she is pretty big on social media.
What does she look like?
So, yeah, we'll still up that title thing.
Well, funny you say that.
Funny you say that. That picture was actually taken on Sunday, right there.
And
wow.
is she dead? Oh,
Yeah.
she's dead.
Yeah, she died.
Good Lord.
So this story is pretty crazy.
She fit.
Yeah, that's part of why this story is crazy. Like, you guys, I want to hear what you guys think about this. So Luana was a 29-year-old Brazilian model, reality TV star, influencer. She had her own clothing line. I mean, this girl was like on top. She's really big on Instagram. I think she had like 500,000 followers on Instagram, so she's pretty legit. So Monday, so just 4 days ago, she died from complications of plastic surgery. Now, this is where the story gets really odd. So the hospital reported that she was having liposuction of the knee. And now, I've done liposuction of the knee, okay? It's not common, but occasionally people will have these kind of unusual fat pads around the knee. And
I was like looking at my knee.
Yeah, I know, Sarah. Sarah's looking at herself.
My knee's fat.
Sometimes patients will have this kind of unusual fat collection, usually kind of on the inside, right above the knee.
Okay, yeah, I think I know what you're talking about.
And I have done liposuction of the knee a few times, like maybe 2 or 3, not something we get a lot of. And I've done tons of liposuction, so it's not like I don't do liposuction. I do, it's just I've just only done a few of these. But the confusing part is, well, there's a lot of confusing parts. So first off, the hospital reported that the patient suffered a respiratory event 2.5 hours into the surgery. Now, the last time I did liposuction of the knee, which actually was not that long ago, it was this year, it was a few months ago, I think I was done in 30 minutes.
Yeah, I was like, that's a really small area, 2.5 hours.
It's a tiny area. I mean, liposuction does not take long, even in larger areas.
Yeah.
Usually what takes the longest with liposuction is repositioning. Because like say you want to do your hip, like you have to put them on their side, do one side liposuction, then flip them over, and then do the other side. And it takes time to do that. The actual liposuction doesn't take that long.
Right.
I mean, it's pretty quick. So 2.5 hours into a liposuction of the knee makes 0 sense. That makes no sense. They said that she suffered from a massive thrombosis. One article said massive thrombosis. The other said she had a pulmonary embolus. So have we talked about PE, pulmonary embolus here? Maybe once? I don't know. All right, so
I don't know.
Pulmonary embolus is when you get a blood clot in your veins and then it goes to your heart and then through your heart to your lungs. But what happens is it goes to the lungs, the blood vessels go from really big to really small. And so the clot blocks the blood flow to the lungs, which then stops oxygenation, and then you die.
Right.
And it's very, you don't always die from PE. In fact, my father-in-law had a PE, and it hit him pretty hard, and he got sick, but he survived, and he's more or less fine from it.
Okay.
So they are survivable, but it's just odd. When you talk about pulmonary embolism and surgery, it's generally something that happens after the fact. It is a risk to develop clots from being in surgery because you're immobile. Sometimes the surgeries themselves, especially orthopedic surgeries, can injure veins, which then cause a clot. And then a few days later, the clot breaks loose and it gets into your lungs and you have a PE. Now, normally, when people have PEs, they're usually small clots and it causes them pain. They go to the hospital and they get treatment and they get better.
Okay.
For her to have a massive pulmonary embolism during surgery just literally makes no sense. Like, it just doesn't make sense. I mean, in order for that to happen, you almost would have to think that they injured some big vein, which then started clotting, which then showered the clots into her lung. I mean, I guess that's possible, but it just doesn't jive with the story. I'm not really sure what happened to this poor girl because the story doesn't make any sense. And so I question if she had a pulmonary embolism. The other thing, as soon as I saw the story, I was like, she had a BBL. And I was like, the thrombosis is fat embolism. Because there is a little bit of a language, not barrier, but like the Brazilian hospitals are reporting, in Portuguese, and then there's this translation. And so I wonder if in the translation, they're confusing fat embolus with pulmonary embolus. Because that story makes sense that, she could have died suddenly from, I mean, we've done, how many stories have we done about people dying from fat embolism from BBL? I mean, in the last year, we've done several,
Yeah.
And so I wonder if it's that. It also would make sense too, because if they were doing 2.5 hours of surgery to get fat to do a BBL, that makes sense, right? Instead of just liposuction of the knee.
Yeah, that's weird.
Yeah, it's weird, and I don't have all the story. Another thing too, I throw up those. I want to show the pictures of this girl. If this girl came into me and wanted liposuction, I'd send her packing. I mean, this girl doesn't have any fat on her. I mean, look how fit she is.
Yeah.
The whole story. Look, I do this one because it had her knee. I pulled these off her Insta.
She's got some fat knees.
You think she has fat knees?
No.
Oh, okay. I was about to say, I need to get glasses.
That's like the weirdest thing for somebody to comment on, anyways.
I know. I just don't know. You know, I feel bad for this girl because if that girl came to me and wanted liposuction, I would tell her no. Like, there's just not enough to liposuction on her. Like, it'd be unsafe, you know, and not like death unsafe, but that she would scar because you were taking out too much fat.
Yeah.
And so, yeah, I don't know what happened in this situation, but I mean, I feel bad for her, and I don't think she was married, but she had a boyfriend, and I can't even really comment on how to protect people because the story doesn't make sense. You know, the one thing I would say about this is, if you look that great and you're looking for plastic surgery, I mean, you have to question a surgeon that would agree to that. You know, somebody that would agree to do surgery on her, I think, is questionable as a surgeon. I mean, especially lipo. Yeah, I mean, that's just, it's, you know, it's them doing something for money and not because it's safe or right. Mm-hmm. You know, I mean, look at her. She's like, I mean, she's got like an 8-pack.
I know.
I mean, where is the fat on her? She has no fat.
On her knees, apparently.
I guess, but I don't think that that's right. I mean, because 2.5 hours, I mean, 2.5 hours is just an unheard of time to do liposuction unless you were lipoing, like maybe if they lipoed her entire leg. I mean, she looks muscular. Her legs look kind of big, but it's because she looks muscular.
Yeah, she has some thick thighs, but those are definitely because
I mean, there's like a whole...
works out.
Most of her Insta is like her at the gym. Well,
Yeah.
not most of it, but there's a lot. Like her doing squats and deadlifts. I mean, her legs are big because she's like...
Yeah, because she's got muscles.
She's muscly, yeah.
Real quick too, Dr. Herman, going back to her earlier story.
Yeah.
Cindy Herman, she commented, we are blessed to witness some of the miracles of modern medicine. Also, the OR team that consisted of 140 physicians, nurses, and other healthcare staff.
Oh, wow, for that face.
For the face transplant.
Yeah. It would be something crazy like that, you know, to do a case that big. I mean, you'd have just countless doctors, and then all the pre-op team, the post-op team. That's wild. There's a transplant team involved, you know, because of the transplant medications they have to take. Yeah, I could totally see that being an enormous team. Yeah, pretty cool story. But
yes, indeed.
All right, well, I don't know what to say about poor Miss Luana Andrade. It's super sad. I hope that they get to the bottom of this, and you know. I don't know if someone's going to be held responsible for this or not. I mean, it's certainly a questionable story and as to what happened to her, and potentially something may have been done that shouldn't have. But I guess hopefully time will tell.
Yeah, that one's strange. I think that's the strangest lipo situation I've heard.
Yeah.
Or just plastic surgery.
There's something odd going on there.
Yeah.
So.
Weird.
All right, I think about that's all the time we have for today. Thank you guys so much for tuning in. Please leave us a comment and let us know what you want us to talk about, and we'll see you on the next episode of Nip Talk.